My project is within the cardiac catheterization lab, and it's based on closed-loop communication, specifically around blood compatibility. Next is the biography page. My name is Megan Watson, and I have dedicated the last 11 years of my career to the cardiac catheterization lab, building a deep expertise in diagnostic and interventional cardiovascular procedures. My clinical skills, attention to detail, and commitment to patient safety quickly gained me on my first promotion to senior coordinator of the cardiac cath lab. 3 years ago, I transitioned into a role as a cath lab manager where I had the opportunity to be the project manager of opening a brand new cath lab within a local hospital. Acknowledgements. I would like to extend a sincere gratitude to the entire cath lab team for their dedication, hard work, and unwavering commitment for excellent patient care. Why did I choose this project? I chose this project to make sure there was an effective communication and that it was the foundation of safe patient care, especially in high-risk environments like a cardiac catheterization lab. Project goal. The goal of this project is to implement a standardized closed-loop communication process within the cath lab to ensure that all team members are promptly informed when blood products ordered are due to be discontinued due to an incompatibility, striving to reduce the risk of miscommunication and improving patient safety. Objective. My objective here is to educate staff on blood compatibilities and the importance of using closed-loop communication and escalation processes when necessary. It is to improve overall patient safety, develop a protocol for escalation processes, and stop the line process. What happens when incompatible blood is not stopped? Antibody reactions. Even though O negative is considered a universal blood type, patients may still have a pre-existing antibody that could lead them to a hemolytic transfusion reaction. There are also plasma incompatibilities. O negative is packed of red blood cells which carry anti-A and anti-B antibodies in the plasma. When given in large volumes, these antibodies can react with the recipient's own blood type antigens, causing a complication or a blood reaction. Education and training gaps. Staff is not fully understanding the urgency of communicating blood compatibility changes. Lack of training on proper transfusion protocols and closed-loop communication. New and float staff unfamiliar with the cath lab specific processes. Action plan. I have 4 items on my action plan. The first one would be staff education. The second is stop the line. The third is safety story. And the fourth is escalation process. To start with staff education, I did make this flyer based on closed loop communication, and it also has different facts about blood compatibility issues to hang around the department. So it's something that the staff can just do a quick glance at, and hopefully it'll pique their interest to maybe look up the topic more and to learn more about it. Next, for my staff education tool, I created a safety story. I made up a person named Betty in a situation that had a background, assessment, and recommendations on it to have a sort of a safety story to hopefully connect emotionally with the staff members so that if they were to encounter this problem again, they would think back to Betty during the safety story and do what was right for the patient in front of them. Next is the escalation process that I created. This is a patient safety escalation and stop the line process. It empowers the employees to be able to stand up in any instance and not fear retaliation. Goals. Some of my supporting goals for this project is one, to educate all cath lab staff on blood compatibility, risk, and the importance of timely communication when incompatible blood is identified. Number 2, implement a standardized closed-loop communication protocol for discontinuing incompatible blood orders. 3, empower staff to stop the line when a patient's safety concern arises without fear of retaliation. 4, establish a clear escalation process for staff to follow when safety concerns are not being acknowledged. 5, reduce the risk of transfusion-related errors caused by communication breakdowns. 6, build a culture of safety, accountability, teamwork within the cath lab. Conclusion. This project was developed in response to an identified breakdown in closed-loop communication within the cardiac catheterization lab regarding discontinuation of blood products that were incompatible with the patient. The failure to promptly communicate when incompatible blood should be stopped created a significant patient safety risk that needed to be addressed. This project is especially important when we are doing handoffs between department to department or intertransfers via our life flight partners to another hospital for a higher level of care. Through this project, a standardization closed-loop communication protocol was developed and implemented to ensure that all cath lab team members are informed in a timely manner when critical changes to blood orders occur. Staff education was provided to reinforce the importance of transfusion safety. Clear escalation process was established to empower every team member to speak up when they have a safety concern. The stop the line concept and the safety storytelling was another way that was incorporated in the team culture to further enhance their awareness and accountability for blood-related compatibility issues. Here you can see a list of references where I was able to get some information from my paper. And lastly, I would just like to thank all of you for taking the time out of your day to listen to my project.